Guys, welcome back to Medical Coding with Blue. Today's episode is all about from medical coder to medical coding auditor. What you should know and some steps to prepare yourself if this is what you want to do. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I had a very straightforward exchange with a viewer about this very topic, but I do want to say this first. To be a medical coding auditor is one of the things that you essentially earn by being in the industry and by having knowledge. Being a medical coding auditor takes a supreme amount of knowledge in order to do it correctly. Not only that, you have to have a willingness to be humble as well, because you are telling people, essentially as an auditor, when you see things that are wrong. You need to be good at research. You need to be able to find your resources to back you up. And these resources have to be from reputable sites, like, of course, CMS, or it has to come from Coding Clinic or CPT Assistant, or from the guidelines, the official coding guidelines. Something, it's got to be something official. It can't be welovetocode.com, you know. It can't be anything like that. It has to be something official from a medical dictionary, you know what I mean? Like those types of things. And because of that, sometimes people struggle. There are more auditors that think they're a good auditor versus auditors that know that there are things that they don't know and that they're willing to accept the education. Because you have to be, again, very well educated to do an auditor position well. I've had many instances with auditors who don't know basic things, who don't understand the fundamentals of basic things, and anatomy and physiology and pathophysiology. These are things that auditors have to know forward and backward. If everything that you know besides the coding, you have to know the body forward and backward. And not having any experience in coding that particular specialty or coding for that particular setting, that is literally not an excuse when it is your knowledge that your organization is depending on in order to be able to stay compliant and to be able to have encounters that can be submitted and paid and everything, and paid well. All right. And so, because obviously the documentation and the coding is good, you know, that's what auditors do. Auditors are looking at codes that have been previously selected by the coder in most instances. And sometimes in the instance of the providers, they're looking at that as well. But they're basically the auditors looking at codes that are already selected by an individual and checking to make sure that it is correct. They have to know about clinical documentation. They have to be able to understand and interpret nuances of different specialties. And there's a lot of different specialties. And again, if you are weak on a particular subject, or you're weak on anatomy, or you're weak on medical terminology, that's something that you need to be working to improve yourself on if this is ultimately where you want to go. A good auditor is going to take the time to look up a reputable reference when they see a correction that needs to be made. And they're going to talk to the person who made the error. In this instance, if it was another coder, they're going to talk to that coder. And you have to talk to them in a way that is respectful, because a lot of times coders, their feathers will come up. There's actually a meme that was out. It was a peacock, right? And it says every time a coder is told that they're wrong, you know, because of course, as coders, we don't want to be told that we're wrong. No one wants to be told that they're wrong, you know. But again, it's about having good communication skills, because sometimes as an auditor, you may see something that you think is wrong, but then once you talk to that coder that's in that particular specialty who can explain it to you based on, proof of, their reasoning, then you can kind of see things from a different direction. And you have to be able to be willing to pivot and be willing to be like, oh, okay, I can see it from your point of view. The most horrible person to be an auditor is somebody that thinks they know everything. And somebody that thinks that no one needs to tell them the correct answer because they have all the correct answers. And there's people out there like that, unfortunately. But it happens. You know, sometimes people get taken in just because somebody has a string of credentials on their name, and they'll have like the CPMA, and they'll say, oh, well, they have the CPMA, so they clearly must understand how to audit, right? If you don't know, the CPMA is a certified professional medical auditor, right? And this is somebody that looks at all the regulations and looks at everything and can audit. There's not a education requirement as far as like you have to have a degree in order to get the certification. Anybody can get it. Like if you get the membership with AAPC, you can, and you take the test and you pass it, obviously you can have it. And CPCAs have the CPMA, which personally I don't think is right. If you have not been in the industry and you have never experienced audits, or you have never audited, whether it is looking at the document to make sure that everything is there or checking somebody else's work, if you've never done either one of those things, you should not be getting an auditor credential. That's my opinion, okay? Obviously, I know I upset some people. There's nothing I can do for the oversensitive. There's nothing I can do for the oversensitive. But what I am saying is this: your knowledge is what makes you, you. The caliber of every medical coder is going to be different. So it is going to take you to be willing to learn, and it is a constant learning process. I am 17 years into this field. 17. Am I an auditor? Officially, no. But when it comes to, do I audit my provider's records? Absolutely. Have I audited other medical coders? No. Do they come to me for help? Yes. But there is a difference, okay? And this is the thing I want to also bring up too, is the knowledge base has to be there in order for you to successfully do your job. It doesn't matter if you've come over because you say, oh, well, I have a degree and I have this advanced thing. If you haven't been coding, which is in the message I'll read here in a minute, but if you haven't been coding, that's a big part of the problem. So let me get into this before I get off the rest of this topic. So the person says, hi, Blue. I found your YouTube channel and really like how informative the channel is. I have my CCS since 2018. I also have a Bachelor of Science in Health Studies. I have been working in billing and coding. Currently, I do research medical coding. I oversee charges to make sure charges are billed correctly to either the insurance or the grant. I do not currently code per se. It's more of making sure that the charges are billed appropriately. I am looking to get into an auditor position. What books or classes do you recommend to prepare myself for the position? Or maybe you mentor yourself. I have an interview soon for a compliance coding auditor. Thanks for any advice. And I said, I'm not sure how you would want to get into auditing without actually having done coding yourself. Overseeing charges, as you say, does not an auditor make. What you're doing is billing, right? And it says, I say I don't mentor, but I do tutor. Auditing is about knowing every specialty of coding and every type of clinic coding with evaluation and management, from all the way from evaluation and management to same-day surgery to the nuances of the emergency department, for example, right? Additionally, medical terminology, anatomy, pathophysiology, pharmacology, you have to know all of those. If you don't understand those forward and backward, you are not ready to be an auditor. But if that's what you want, then you will study and go back over your workbooks, because it doesn't require you to go to a class. It doesn't require you to have a certification. What auditing requires you to have is knowledge. The only way you're going to get that is literally from the book. You can sit with your ICD-10-CM book, your CPT book, your ICD-10-PCS book. You can go through those things. You can learn about the coding. You can learn about the sequencing. You can learn about the modifiers. You can learn about all those things depending on which book you're in. then you can get one of these books that I always recommend, the Nellie Leon Chisholm book, the ICD-10-CM and ICD-10-PCS Coding Handbook with the Answers. And that's what you learn from the CPC study guide. Yes, the CPC study guide, because even though that is outpatient and it's for the CPC, I'm not saying to get the CPC. Okay, first of all, I'm not saying that the CPC is bad. Y'all know better than that. What I am saying is, when it comes to the way that AAPC wrote that CPC study guide, it is fantastic for people to get a refresher on the different specialties in CPT. It has a very straightforward way of explaining things. And like I say, if you cover up the answers, that way you can treat it like it's real world, and you can look the stuff up, because the real world is not multiple choice. And if you're able to find those codes, then that means that you know how to find the codes. If you know how to find the codes, you know how to read and look at those documents, it's going to make the auditing process much easier and much more easier for you to get through. And you're going to be able to spot things a lot faster than somebody who's not doing that. I'm just saying. And then they responded with, "Thank you for replying. I understand what you're saying and agree with you, but also trying to see what options I have. I have always wanted to do coding and always looking for a job specifically in coding. It just so happened I got a job in research, and I'm at my current job for a few years already, but still wanting to do coding. I know medical terminology, anatomy, physiology, and pharmacology." So what I said is, please don't misunderstand my message. Knowing medical terminology, anatomy, and physiology in pharma is par for the course. However, when people want to do something specifically like auditing, there must be a deeper level of knowledge. For example, I, as a coder in orthopedics, would expect you to know what a Lisfranc fracture is. Further, I would expect you to know that you would not be able to find that particular name, right, the diagnosis, in the ICD-10-CM. Furthermore, because I would expect you to know anatomy, you would know that a Lisfranc fracture is technically a dislocation of the tarsal metatarsal bones, which I could get into a whole episode about that. But it's a part of the foot that is held together, and when those bones get out of place, which it is possible because of how Lisfranc fractures occur, that's what happens. So a lot of times it's not actually a break in the bone. That's what is referred to as a Lisfranc injury, Lisfranc fracture, because those bones are out of place. Okay, there are exceptions, yes, but the actual bone will be specified. But when we're talking about Lisfranc, that's what we're talking about. So it says, if you're auditing the ER, I would expect you to know that the ER is one of maybe 2 or 3 settings that would allow for an E&M to be reported twice in one day, with the addition of modifier 27 as appropriate, right? Because that's for the multiple. Again, that doesn't happen in the outpatient setting, but in the ER, you can put a modifier 27. It all depends on what happened. So the way that I've always explained it is, if a patient comes in the early morning hours, they were in a car accident, okay? They were in a car accident and they had some bumps and bruises, but everything is fine. They patch them up and they send them home. Later on that evening, they start to feel chest pain and they come back to the ER. So about 5 o'clock, they're in the ER, and then they say, okay, I've got chest pain. They take them back. They're finding out that this person's having a heart attack. These are 2 different things that happen in the same day in the ER. So the ER E&M code is coded for the first one. The ER E&M code is coded for the second one, depending on what level it is, with a modifier 27 on it. Okay? Because this is signifying that there are 2 E&Ms in the same day, okay, that are significantly separate and all that good stuff. But they're basically that they stand alone by themselves. These are 2 different things, and this person is coming back to the ER for a second visit. That's a terrible day for that person. But that's something that you would have to know as somebody who does auditing, okay? I would expect you to know that walking in. There are many, many auditors who don't understand that. There are many other specialty nuances, but that is what you have to be ready for. And I said, I'm not trying to discourage. I only want you to know that when you are a coder, you'll know this. It's hard walking in as an auditor, not having experience firsthand as a coder, right? I encourage you to work through coding workbooks and get your practice in that way. It's great that you are a researcher, but make sure that you are applying and that you're applying that research to practicing coding, and then you'll make a great auditor after that. They said, I see. I appreciate your honest response. And after watching your YouTube videos, I realize you can give an honest opinion. That's why I decided to contact you. I will definitely go through the workbooks. Are there any specific practice tests that you would recommend? And I said, don't worry about the practice tests. Just work through the workbooks. And thank you for understanding, because sometimes people just don't get it. And as an auditor, one of the biggest things is that you have to have a thick skin. Sometimes for some auditors, it doesn't take much to rile them up. If they tell you that you're wrong, and then you tell them, no, well, here's what this is the reason that I was able to come up with this code. And then they get offended because they feel like you question their intelligence. Okay, this has happened to me. So that's why I have to explain this, right? So when I've explained before, hey, this is the reason that I got this. According to CPT assistant, coding clinic, Merck manual, whatever, the auditor got offended. They were personally offended that I had the temerity to question them. Well, it's not that. It's that this is actually the correct way to do it. And I understand not knowing it, because if you're not in orthopedics, which is very specialized, if you're not in that, if you're not in podiatry, I understand. But if you have your experience, you start off like, say, for instance, in the ER. The ER is a fantastic place for people to get lots of experience in one sitting. However, there are certain things to working in the ER that are specific to the ER, right? And not only that, when you're working in the ER, things are just about, let's patch this person up. We don't know. Let's send them off to the specialist. Let's send them off to ortho. Let's send them off to cardio. Let's send them off to neuro. We just want to get them stabilized and get them where they got to go. That's what they do in the ER. So like I said, it's a smorgasbord. You can literally code for a lot of different specialties getting started in the ER. But if you're going to get into the auditing side, you already have the ER down. Your next stop should be the orthopedic clinic. Your next stop should be the podiatry clinic, urology, neurology, any of those, rheumatology, any of those clinics. You go through all of the clinics that you have in your facility, right? In your doctor's office, not doctor's office, but in your medical group, in your hospital. You go through every single one of those specialties. And if you say, well, Blue, I'm just a coder, I can't do that. Then you go to your supervisor and you volunteer to be cross-trained. You tell them, hey, and you got to make it look like this is to benefit them, which technically it does benefit them, okay? But it also benefits you as well, because if you were to say, I would like to have the opportunity to be cross-trained. I'm doing great in the ER. But in case somebody in some other specialty like ortho, needs to go on leave, or they have to go on emergency leave or something, I can fill in. Give me a chance to work some of those encounters. You will find that a lot of times supervisors will be like, okay, sometimes they'll say no. It really all depends. But even if they do say no, it literally doesn't stop you from getting a workbook. Yes, I know it's backwards. It doesn't stop you from getting a workbook and working out yourself. It doesn't. And again, people that work through these workbooks, like from the Nellie workbook, this is by Nellie. Nellie Leon Chizen wrote this book, who I am a huge fan. I am a very huge fan. And I love this book. Even though it says from beginner to intermediate, I really think a lot of these are really more intermediate to advanced, because they are like, some of these, I've gotten stumped on them, okay? I'm not saying that I know everything. And that's the thing that you have to be able to adopt, that you don't know everything. Every day is an opportunity to learn. Every day. Because as I've said, as coders, right? As coders, we have to know what a doctor knows while never having gone to medical school. And so because of that, that's the thing, that we have to be prepared for everything, okay? So getting yourself a chance to go through every single specialty in your facility, plus if they have professional fee coding, the pro fee coding, you have to be able to volunteer over there and get your time in, not volunteer like you're not getting paid. You are a coder that is working and you're asking to, help out in that specialty. That's what's happening there. So that way you can get some practice with that too. Because as an auditor, you're not only going to be auditing one thing, you're going to be auditing a bunch of different things. So again, because of that, you want to make sure that you're getting exposure to all these specialties. In my 17 years, I have coded everything that my facility has to offer, with the exception of the inpatient setting with coding ICD-10 PCS. Do I know how to code ICD-10 PCS? Yes, I do. Why? And not only that, I still work with my ICD-10 PCS book with all of my Patreons and people who I tutor and things like that. So I still get plenty of exposure. I still know what I'm doing when it comes to the inpatient side coding, all right? But that's a skill that you're going to have to take the time to build. So whether you get the experience working in-house at your facility, which would be best, or you're having to get the workbook and work through that, that's something that you can do for yourself. That's a proactive thing that you can do for yourself. The other thing that you need to be doing is making sure that you understand forward and backward anatomy, medical terminology, physiology, pathophysiology. You have to understand all of it. I mean, all of it. There's no, oh, I don't like that. I don't like this. I don't like, no, there's absolutely none of that. Because again, that's going to make for a lesser auditor. That makes you not as good. People will not learn from you. And being a bully, right? And saying, oh, well, auditor stands by her word. Do you think I care about your word if your word is wrong? No, I don't care about your word when your word is wrong. I'm about facts. If it's not supported in the guidelines, if it's not supported in like somewhere, CPT assistant, coding clinic, somewhere official. If I can't look up this thing about anatomy and find what you find, I'm going to go with what is right. I am not going to go with what is wrong just to go along to get along. And that's an ethical coder. That is somebody like me who is going to hold myself with high integrity, because I will not be pushed around because you want to be right. If you are not right, I'm going to show you why you're not right. But if you are right and I'm wrong, am I going to like it that I was told that I was wrong? Who likes to be told that they're wrong? But you learn. But you accept it. I'll accept it. If you show me in a guideline, hey, Blue, there's this guideline. Oh, man, I didn't think about that, or I didn't see that. Or, oh, okay, now I get it. You know what I mean? I will correct it. But I don't do the whole thing based on, well, just because I said so. And there's a lot of auditors that are like that. I don't know if it's because after a while some of the auditors get so worn down with people getting upset with them for questioning and things like that. And sometimes, if they have to argue with somebody that does not want to accept the error, because you can be just as nice as can be about an error and say, this is a reason that this is wrong. And the person's going to get all upset and mad because whatever's going on with them, or they don't know as much, or they feel intimidated, or it's just like an anxious response, because a lot of times the yelling, the screaming, that is an anxious response from people, right? And I've had that before too. I had a so-called friend, right, who sent out advice, and I went to this so-called friend and I said, well, actually, here's the regulation for this, here's the guideline for this, and actually, this is the meaning of this when it comes to this in this particular setting. Oh my gosh, it was like the end of the world and everything. It was just like I was just so wrong for what I said. No, actually I wasn't, because I did what I was supposed to do and I copied our boss on there. So it wasn't like I said anything out of control. You know what I mean? Like, it was literally just like, here's the guideline, this is this and this. But she was upset because she didn't want to be wrong. And it's unfortunate when that happens. But if you want to get into an auditor position and you want to be a good auditor, you're going to listen, because there's going to be times when you're going to be wrong. You're going to see things that are incorrect. You're going to go to that person, and then you've got to try to figure out a way to help them to learn it. And sometimes when people might fuss a little bit because you're telling them they did something wrong, but if they're trying to be right, and they say, okay, well, this person does have like their official reference and things, they may bluster in the moment, but then later they'll be like, okay, I'm really glad because I learned something, because otherwise I would have kept doing the same error over and over again. So again, this is what you're getting into as an auditor. It's a lot. You got to learn to read people and their body language. You gotta, every single person is going to have something about them, some little quirk that's going to make them tick. There may be some people that you can look at that you will know that this person wants to get down to business. And then you'll see another person that they're going to want to take a little bit more time, and then you got to talk to them a little bit like, hey, how's your family doing? Something like that. Obviously, of course, if you know the person, but there's going to be some people like that they're going to want to take things slower, because this is a conversation to them. And other people, get right to business, please. We're here to get right down to business, and we're going to be figuring this thing out. But again, there's some people that you got to talk to them, you got to ask them about their family, you got to see how they're doing, and get a feel of what's going on. But again, you have to be open to those experiences. You have to be open to that, to those challenges, because you will be challenged on a daily basis. But when people notice that you're coming to them with books, and you're coming to them with regulations, and you're coming to them with a very even keel attitude and energy, that's going to change things. You'll find people to be more receptive to you. And when people know that you're listening to them, that will help them to open up even more. Because then it may lead to more things of, okay, well, if they explained this to me, then I can feel safe to go to them and ask them, hey, I know this about this subject, but I keep having trouble with it. Can you help me? And they're more likely to help you. Okay, so it is a two-way street. It is definitely a two-way street. And coders can go a long way to learning how to interact with their auditors as well. Because there's some coders who get very fearful if an auditor raises their voice, or auditor says, I stand by my word, and then they're going to just crumble. Oh, okay, well, I guess they're right then. No, if you know that you're right because you have a regulation or something to back you up, a guideline, then you need to speak up. Because it's not about us. It is not about us. At the end of the day, it is not about us. It is about the patients. So every time you think about your ego and fighting against somebody who's telling you, hey, you got an error on this because of XYZ, and you think about fighting against them, you think about that patient. That patient who could very well be you, your mother, your father, your sister, your brother, your best friend, your husband, your wife, your friend, any of these people. you could be their coder. And you think about how you would feel if somebody who was coding for somebody that you love, or even you, they were coding for you and they're going to just insist on coding the wrong thing because they're not going to listen to the auditor because the auditor doesn't know what they're doing. And even though the auditor has shown that they have proof with official guidelines and references and things, and you want to sit there and act like you're not going to listen, you think about that, because it's not about you. These are not your records. They're the patient's. It's the provider's work. And we are just the stewards of this information. We're just the stewards. And so it's a huge and tremendous responsibility, because again, the data that we collect, right? The data that is audited and says that it is absolutely correct. That's data that's reported for programs, social programs to help people, preventative programs to help people to become more literate about their health and their health conditions, because that's the problem. A lot of people don't understand, and they don't understand about their specific situation. They'll go and they'll Google, on WebMD or whatever, and they'll scare themselves because they think they've got all these other things too. And it's actually not even that. So it's important to promote health literacy. And the only way that we're going to be able to do that is by having good data. And how do we get good data? We get good data from having very excellent coders and an excellent auditor to make sure that those codes are correct. That's what you're getting into if you want to get into auditing. It's a huge responsibility, guys. But it takes you to be patient. It takes you to be understanding. It takes you to know a lot. And if you're not so strong in anatomy, medical terminology, pathophysiology, and pharma, you need to be working on that. All of those things are important. Why is pharma important? Because if a patient is taking a particular medicine, you don't think that might affect them in certain ways, and that data needs to be picked up, or it may affect the code selection, especially if there's adverse effects. Those are things that you have to think about. Everything is interconnected. Everything is. But I'm going to go ahead and wrap this one up because it's getting kind of long. But I hope this video helps you, because again, all you have to do is start practicing. You want to be an auditor, you start practicing. If you're a coder, you start putting yourself out there on the front lines, and you start asking your supervisor, be proactive about it, and ask them, I would like to help to be cross-trained. I want to be cross-trained to other specialties, just in case somebody else is out. I want to be able to cover for them. I want them to be able to, we're not scrambling at the last minute for help. Okay? And that shows initiative. And that's a good leadership quality to have. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.